Hello, everybody. I am so happy to be talking with you again. If you don't know me, my name is Dr. Lindsay Ogle. I am a board certified family and obesity medicine physician, and I have been doing a series on diabetes. Today, I'm going to talk about what a typical visit looks like for somebody who has already been diagnosed as having type 2 diabetes. And the visits can be similar to type 1, but I am specifically talking about type 2 diabetes in this series. Patients who have type 1 diabetes, it's really different physiologic in their body. Their pancreas is no longer secreting insulin, so they cannot process the sugar in their blood. So they are insulin dependent, meaning that they are always needing insulin infused into their body so that they can manage their blood sugar and keep it at a safe and healthy level. And these patients are usually diagnosed at a younger age, usually during childhood, but sometimes young adult or as an adult, and they are best managed by an endocrinologist whenever possible. I just wanted to go over that because it is quite different in how they're managed. Type 2 diabetes is what is most common and usually what people are referring to when they say diabetes. So this is the insulin resistance, and so your body is still making insulin, but it's not using it appropriately. And so we need to address the underlying factors, that insulin resistance, through lifestyle modification, increasing physical activity, managing stress, adjusting our nutrition intake, our nutrition plan, and medications are often very helpful. And sometimes that includes insulin, but not always. My two previous videos were about those two topics, the lifestyle modifications and the diabetes medications. So I'll have the links below so you can watch those if you missed them and are interested in reviewing the treatment options for type 2 diabetes. But again, today we're going to talk about what a typical diabetes visit looks like. And most patients with type 2 diabetes can either be managed by their primary care doctor or an endocrinologist. So it really depends on what your primary care doctor is comfortable with and what you're comfortable with as the patient. So usually appointments are about every 3 months. And this really depends on how well controlled or uncontrolled your diabetes is. So if your A1C is pretty high or it's a new diagnosis of diabetes, you may be seen more often, whether that's once a month or once every other month, definitely every 3 months. If you're really well controlled and your blood sugar and your A1C is at goal, then oftentimes we're able to space out your appointments to longer than 3 months. Some people like checking in every 3 months to get that A1C done, but you really could go out to every 4 to 5 or even 6 months. Usually for all of my patients with diabetes, I like to see them at least twice a year, even if they are well controlled, just to make sure that we are catching anything if it is going in the other direction. So I mentioned A1C, and this is really one of the first steps in a diabetes visit is to check that A1C level. Now, I've mentioned this before, the A1C is a special blood test that is able to kind of calculate, along with your red blood cell count, how much sugar has been in your system over the past 90 days or 3 months. And so it's an estimate over an extended period of time. So it gives us that big picture, taking a step back and looking at what the big picture, the average blood sugar has been. So it doesn't give us a lot of information about spikes, ups and downs in your blood sugar levels. To know that, we really need to have you wear a continuous glucose monitor or CGM, or check your blood sugar periodically. But the A1C is a really great number to watch over time, and this is what was almost always obtained during a visit for diabetes. And this can be done in the office with a point of care test, meaning that the medical assistant pricks your finger just at the very tip, gets a small amount of blood, and then runs the test in the office, and we get the results back in about 5 minutes. And then we have that result and we can make adjustments depending on what your A1C is at that time. So it's really, really cool tool that we have in medicine to have that results right away. Even before we do your A1C, we get your vitals, check your blood pressure, your heart rate, oftentimes your weight, sometimes we check your height to make sure that that hasn't changed. And then we review your medication. So we make sure that we are both on the same page of what medications you are taking and how much you're taking. We'll review if you're having any side effects of the medications, especially if they're new, but even if there have been medications that you've been taking for a long time, we want to check in and make sure that you are tolerating them well. We want to make sure that you're able to get them at the pharmacy. We know that some of the newer medications have higher demand and sometimes you haven't been able to get them at the pharmacy. We need to know, and it's really important to just be honest and open with your doctor about whether or not you're taking your medications, because we're making decisions assuming that you're taking them if that's what you've indicated. And so it can be unsafe. We may recommend going up on a dose of a medication, but really if you haven't been taking it, you probably don't need to go up on it. We just need to find a better strategy to have you be able to take it on a more consistent basis, whether that is working with your insurance company to get a lower copay, using a coupon, working with a pharmacist, or switching to a different pharmacy to have a more steady supply, or switching to a different medication altogether. So as anything in medicine, being open and honest about what's going on with your healthcare team is really important. After that, I often check in on how lifestyle is going. So this is looking into things like diet. Has that changed significantly? Was there something that we were working on adjusting, whether that was cutting back on added sugars or sugar sweetened beverages? Were we trying to increase protein or fiber? Were we cutting back on snacks? Were we adding breakfast? What did we talk about last time and how is it going at this visit? And then we can make adjustments further if needed. And then, I often congratulate my patients on the amazing work that they've been doing. I also check in on physical activity. And this can be the amount of steps somebody is getting if they like to count their steps. It can be how often they are exercising. Are they walking most days? What have they been doing to move their body and take care of their health? And this is something that we start low and increase slowly over time. So that's another major thing that I like to check in on. Something else I touch base on is stress levels. So high stress can really impact our well-being and our health in so many different ways. And so I want to know, are you going through a stressful time at work or your personal life? Is there something that you're really working through that we could provide additional help with? And I have lots of resources, whether that is therapists or counselors or coaches. I have a network of people who I know and trust and can refer you to if that is something that I think that I think you could benefit from and that you are open to trying. I also touch base on sleep. Now, sleep, we hear this all the time, how important it is. Some people, they have no problem. They can get their 7 or 8 hours of sleep, feel rested. That's wonderful. Other people, it's really much more of a struggle. And so this is something that we slowly work on over time. And we will have more information, or I'm gonna need to make a whole video about how to improve sleep, because there is a whole set of what is called sleep hygiene that I go over with patients, and I'd love to do a video about that in the future. Also touch base on, are they smoking? This is another thing that really gets worked on over a long period of time, but the combination of smoking tobacco and cigarettes and having diabetes really exponentially increases your risk of cardiovascular disease, of heart attack, stroke, heart failure. And the combination is really deadly, to be honest. And so when anybody who smokes, we're trying to help them cut back or stop, but especially if you have diabetes, this is of utmost importance. So then there are some screenings that we do, and most of these are annual. One is a diabetic foot exam, and so this is when you're going to have to take your shoes and socks off, and the doctor is going to take a look at your feet and make sure that there are no wounds present. They're going to use this little thin, we call it a microfilament, and it's like a little flexible, like fish wire type of material, and they're going to touch it at the end of your feet to make sure that you're able to feel it in all the locations that they touch. They're going to check your pulse on the top of your foot and then ask you questions about how you've been feeling in your feet. Do you get numbness, tingling, pain, hot and cold, those sorts of things, and keep track of that over time because that can be related to your diabetes. Another thing we want to make sure is that you have seen an ophthalmologist for a diabetic eye exam. And this is something that is done at least once a year. And the ophthalmologist is going to dilate your eye so they can look in the back of your eye to make sure that there is no damage to the small blood vessels in the back of your eye that would eventually lead to decreased vision or blindness. And this is more common in people who have diabetes, and you may not have any symptoms at the very early stages. And we want to catch it at the very early stages so we can treat it and prevent that progression to decreased vision and vision loss. So very important if you have diabetes to also have an ophthalmologist to do that diabetic eye exam. You want to make sure that you at least once a year, if not twice a year or more frequent, have blood work done. And there are several things that we're looking for in the blood work, but one of the most important things is your kidney function. So chronic kidney disease is much more common in people who have diabetes, and it's even higher or more common if you have diabetes and high blood pressure. If you have that combination, even more important to have routine blood work done at least twice a year. And the kidney function is actually both blood work and a urine sample. Not unfrequently, I see patients who have diabetes or high blood pressure and they have normal kidney function on their blood work, but when we check a urine study, we see that there are elevated levels of protein, of microalbumin in their urine, and that's an early indication of kidney dysfunction. And so again, with anything in medicine, we are trying to catch things as early as possible so they can be treated and managed and prevent the complications later on. So important to have that blood work, an actual blood draw, again, at least twice a year, and then a urine test. I usually recommend once a year, possibly more often if it's been abnormal in the past or if your blood work is abnormal. And then last, we are going to review your vaccines, your immunizations. And so people with diabetes are recommended to have all of the routine adult immunizations that are recommended. So that includes annual flu vaccine, RSV vaccine, and now for adults 60 or above, the COVID-19 boosters, shingles vaccine starting at age 50. There's 2 doses of that and then you're done. And then the bonus vaccine or immunization that is recommended for patients with diabetes is the pneumonia vaccine. So pneumonia vaccine is something that we all get as young babies, but it can wear off as we get older. And so all adults 65 or above, it's recommended to have a booster. But if you have certain chronic health conditions like diabetes, then in any time in your adult life, 18 or older, it's recommended that you get a one-time booster of the pneumonia vaccine. Again, that's just a one and done. So once you have it, then you are covered. Those guidelines have changed in the last couple of years, so check with your doctor because it will depend on which pneumonia vaccine you had in the past, if you need the new booster or not, or if you're covered, and it gets a little bit complicated. So just ask your doctor to review your pneumonia vaccines if they haven't recently. And I just want to make sure that you are all aware that I have actually opened up my own telehealth clinic where I specifically manage metabolic conditions. The clinic is called Missouri Metabolic Health because I'm licensed in Missouri, so I can see patients all throughout the state of Missouri. And I do this. I do diabetes visits virtually. I can do all of this other than the diabetic eye exam, which we refer to ophthalmology anyways, and then the foot exam, which we can kind of talk through and see if you need to get that done in person or not, and we can always coordinate with your primary care doctor to make sure that's done. Diabetes care is something that I'm very passionate about, and if you live in the state of Missouri or know anybody in Missouri who has type 2 diabetes or pre-diabetes, or another metabolic condition, then I highly recommend that you refer them to me, or if it's yourself, check out my website. I will link that below. I am accepting new patients, and I'm going to limit my patients to 200, which is a lot less than the average doctor. Usually doctors have at least 1,000, if not 2,000 or more patients that they manage. And I'm keeping it at 200 so then I can give a lot more individualized attention to my patients, to those 200 patients. So I would love to see you in my clinic, Missouri Metabolic Health. And if you don't live in Missouri, then still follow along, and I'm going to continue to give additional education about these topics that I am so passionate about. And I look forward to seeing you next week.